All right. And welcome to I'll start over again because I started in the Tank podcast, the one I always do, so I got to screw it up. Welcome to the Heartland Daily Podcast. The episode of this is the Healthcare News Podcast. If you're listening to a much deeper voice, that is because our usual host, AnneMarie Schieber, is our guest today instead, as we have a lot to talk about. I'll just go ahead and say the word COVID. They tend to they demonetize and they also suppress videos that have the word COVID, where the algorithms can hear you say the word COVID. We're going to go ahead and do it anyway. But before we get started, I want to ask everybody listening to this podcast or watching it on YouTube to please go ahead and subscribe to both the Healthcare News Podcast and the Heartland Daily Podcast, which is our fire hose of all the podcasts that we produce daily here at the Heartland Institute, full of great information. If you like listening to smart conversations, it's the podcast for you. Without further ado, instead of the host, our guest today is AnneMarie Schieber. She is the managing editor of Healthcare News and the usual host of the Healthcare News Podcast. Welcome, AnneMarie.
Hi, Jim. It's great to be here on the firing line.
Yeah. Well, I think it's easier to be interviewed than to do the interview itself. So you'll probably find it a lot of fun. But the reason we're having this podcast is actually to share with our listeners is that on Mondays, every Monday morning at the Heartland Institute, we have a conference call like most think tanks would do. To talk to our smart folks, our senior fellows, and our managing editors of our publications, and talk about the news of the day, the news of the week, and how we're going to react to it and help inform the public about the free market angle and the freedom-centric angles on everything that's happening in the world. And I don't know, for about 6 months or so now, AnneMarie, you and I are kind of in a contest to see who will rant the most about the freedom sucking.
Yeah. By the end of that meeting, steam is coming out of our ears.
That's right. So we thought, well, why not just make a podcast out of the things that we argue, not at each other, but argue about and get angry about during the conference call. And so there's actually quite a bit to talk about on COVID. And we'll start with, there was a hearing last week in the Senate, the Senate Homeland Security Committee of all things, right. chaired by Ron Johnson of Wisconsin.
Yeah, a champion of liberty. Let me tell you, that guy, you have to watch it just to listen to him.
Yeah. Well, I want to read to you. I don't know if you saw the Washington Post coverage of this. I'm surprised they covered it at all. Yeah. But so talk about steam coming out your ears. Let's go with the lead here. First of all, the headline is Senate holds hearing on hydroxychloroquine despite no evidence it works against COVID-19. On the day that new coronavirus cases in the United States hit their highest total since the pandemic began, the Senate Homeland Security Committee held a hearing on an anti-malarial drug that has repeatedly shown to be ineffective at treating COVID-19. As the country logged 185,424 daily infections Thursday, the committee spent more than 2 hours revisiting discussion about hydroxychloroquine as a potential COVID-19 treatment, a debate that leading health experts say was settled months ago. Study after study has shown that the drug touted by President Trump and his allies as a solution to the pandemic is ineffective in protecting patients against the virus. Top health officials in the Trump administration, including the sainted Anthony S. Fauci and Deborah Birx, I added the sainted part, they have both said that clinical trials show the drug is unhelpful. Now, if you had not seen the hearing, as you had seen it, AnneMarie, you would believe that characterization of the hearing and the usefulness, let's just say that, of hydroxychloroquine and other drugs like zinc and others that against COVID-19, people who get COVID-19. Why don't you just go ahead and explain to people why that description is not accurate?
Well, I can only imagine that the reporter who wrote that story probably did no more research than looking through the Washington Post archives on hydroxychloroquine and found nothing. And probably that's why they said there was no evidence that these home remedies that doctors all over the world are using to keep people out of the hospital with COVID and keep them from dying. There is overwhelming evidence. It just does not see the light of day in the mainstream media. And what's so infuriating is if you listen to that hearing, it went on for almost 2 hours. And, I will tell you, there was there were three witnesses, three doctors came there to talk about early at-home COVID treatment, what drugs have worked, what the conglomeration of studies that have been done, and the evidence. And then the minority leadership on the panel was able to bring in one witness, and this person came in. And it wasn't until the very end that this witness, he was an MD from epidemiologist from Brown, and he admitted that he never cared for a COVID patient at all, at all. And here you have three physicians who have treated dozens, maybe hundreds of physicians who were talking about the success they've had. One of the physicians on the panel, Dr. Peter McCullough, actually had COVID about 3 weeks ago and got into a trial using a drug called ivermectin. I'm not probably going to pronounce it correctly, but there are a couple of antivirals besides hydroxychloroquine that these doctors are using. They put together, they're experimenting with cocktails, and many of them are regimens that involve an antiviral drugs that have been on the market that are safe to use, vitamin supplements, an antibiotic, and then there are protocols. So Dr. McCullough actually wrote up a protocol, and it was published in a leading medical journal. And so they were talking about that. There's another doctor, Dr. Solenko from New York City, who's treated 3,000. I read today, I'm on an email chain with a lot of these physicians, and he was saying that his practice in New York City had treated 3,000 COVID patients. 1,000 of them were high risk. Only 3 died of all of that. And he was practicing these regimens. And it is just stunning to me that none of this sees the light of day. Let's go back over the history of hydroxychloroquine. So they were using this early on in the epidemic or the pandemic. And then President Trump mentioned it, I think in May or April. And then in June, the National Institutes for Health and the FDA came out with guidance that said, we do not recommend hydroxychloroquine for the treatment of COVID. That sent a chill throughout the medical world because doctors were too afraid to use it. States were clamping down. They were empowering pharmacists to turn in doctors who were overprescribing this drug. So doctors were very afraid to use it. And so and it hasn't changed since then. And it's been real interesting because, we had these vaccines that were in the works and they came out amazingly quickly in a period of 3 months or less. And we have now 3 drugs on the market that are probably going to be ready to be distributed here in about a month or so. But I can't help but think that a lot of this anti-hydroxychloroquine conversation has a lot to do with supporting these vaccines. Vaccines are a very risky undertaking for pharmaceutical companies because A, there's a liability concern, and then B, you want to make sure there's a market for it. So you don't want to spend all this time and money and then not have anybody use your vaccine.
Right.
So this thing with the Operation Warp Speed, which the Trump administration did unveil to get this vaccine out the door quickly, was they promised the pharmaceutical companies if they could come up with a vaccine that they would promise purchase of it in large quantities.
Right.
So they basically dropped everything and developed the vaccine.
Well, who was was it? What pharmaceutical company came? Pfizer. Pfizer had the first vaccine announcement conveniently after the election.
Right. A week. Yes.
Yeah. Wasn't that funny? And Pfizer also said initially that Trump and Operation Warp Speed had nothing to do with this. And, anybody with a working brain thinks, knows that's silly because Operation Warp Speed basically, as you alluded to there, guaranteed a market for it. Puts the vaccine in pre-production. In other words, it takes the risk. There's a reason why, at its fastest under normal circumstances, a vaccine, and again, it should be noted, we've never had a vaccine for a coronavirus. We don't have a virus for the common cold, which is not a coronavirus, but it's a rhinovirus. But still, it's an extremely difficult task.
It's a virus.
Yes, it's a virus, and we have very few virus vaccines. And so there's a reason why we were able to go from just dealing with this the first time at the beginning of 2020. Really, it didn't start to really hit hard in the United States until about late February, early March. We go from that to three pharmaceutical companies announcing vaccines, and that's because of Operation Warp Speed, in which regulatory hurdles were cleared away, but importantly, that basically it was a guaranteed income winner for the companies to go about it, because when you take out all of the risk, because it takes years and years to develop a virus, years of research, lots of clinical trials, it's extremely expensive, probably $1 billion per. And all of that was just wiped aside. So the idea that Pfizer initially claimed that Operation Warp Speed had nothing to do with this, I don't want to say it, but I will. It was a lie.
Right. And the timing was very suspicious. So they announced this 5 days after the election and said they had this overwhelming. First of all, they changed the criteria. So they were supposed to make an announcement, I think, after 60 people got COVID. And they ended up, actually it was 35 or something like that. Then they moved it up to 60. By the time they announced it was 90 people got COVID. And that's how they came up with this 90% figure. But what's interesting was when they announced it, they said our next hurdle will be in a couple of weeks when we're going to ask for emergency use authorization. Now, in this release, it said that you had to have 28 days between the last study results and request for this authorization. So that would have been a 2-week period, looking on my calendar, not 30 days. So they had evidence early on before the election that this vaccine was working. And for whatever reason, they withheld it after the election. I don't know. Pharma could be very angry with Trump because of the indexing that he's now going to be doing with Medicare purchases of drugs, tying them to what foreign countries are paying for drugs so that, we're not subsidizing what national health services in other countries are not paying for drugs. But it was real interesting, the timing of that.
Right. And so, we're kind of skipping around here. I want to get back to the hydroxychloroquine and the hearing with Senator Johnson up in Wisconsin. He had said that, again, the cynical, ridiculous Washington Post, he says that Johnson returned to this issue of hydroxychloroquine anyway, calling a panel of witnesses who have publicly supported the drug. He repeatedly criticized the medical community, suggesting at one point that it had censored evidence that hydroxychloroquine could work and that federal scientific agencies may have turned a blind eye toward the treatment because of Trump's promotion of it. Johnson also wondered aloud whether doctors and medical experts were backing another drug, remdesivir, over hydroxychloroquine, because remdesivir sales bring in a lot more money for pharmaceutical companies. Quote, I question the fact that because this cocktail costs about $20 and remdesivir costs $3,000, that maybe there's a little bias, maybe there's a little conflict, and maybe there's a little agenda, Johnson said. And then the story goes on to note that the FDA withdrew its emergency use authorization for hydroxychloroquine in hospitalized patients in June, and it warned against using the drug in outpatient settings because it could cause serious heart rhythm problems. Why don't you, for our audience here, AnneMarie, Schieber, talk a little bit about the claim by Johnson that the evidence that this is working, has worked for thousands of patients, has been censored, not just by the media, but it seems to be our own government and the medical establishment. And is it really is that cynical outlook that it's because remdesivir is more expensive, that's why this has been happening?
And you can only get it when you're in a hospital. So wouldn't you want a policy that gets people into the hospital? So right now the policy is sit home and wait 2 weeks and don't do anything until symptoms become severe. And then you admit yourself into a hospital where you can get these very expensive drugs. So he's absolutely correct. We're talking about $20 worth of therapeutics at home early to keep you out of the hospital, or you wait 2 weeks until things get very severe and the virus replicates. And then you go to the hospital to get these very expensive drugs. I mean, and now we have 2 of them, but again, you have to be hospitalized to get these drugs.
Is it politics that is keeping the United States from treating people before they get COVID, after they get COVID, during having COVID? Is there more politics involved than science here?
Oh, absolutely. When did we get this idea to stop allowing to not allow doctors to treat their patients as they see fit? You know, off-use prescribing has been a tradition for doctors. They use off-label um, drugs for off-label purposes a lot, especially for drugs that have been on the market for years and are very safe. And then for some reason, for this particular virus, they had to come out with guidance and say, no, you cannot use it in this circumstance. It's very
Right.
suspicious.
Yeah, HCQ is a it's been around for 70 years. I think the patent ran out 70 years ago, and it's used quite commonly by people with rheumatoid arthritis, I think, and other conditions, and it treats them very
Lupus,
well. Yeah,
malaria. It's
sure.
widely used in India to prevent the spread of malaria.
Right.
And COVID has not been look at all the people in India, and it's not been a problem as it has been in Western countries. And it's not just the U.S. Um, that has censored information on HCQ. It's Australia, France, the UK, Western countries. You know, it's interesting. We forget there were two big HCQ studies that came out over the summer by our leading medical journals, the Lancet and the New England Medical Journal. They had to pull the studies. They were fake studies. They claimed that HCQ did not work. It was caused very severe side effects and complications in patients, and then they could not verify the data that was used in this alleged study. Something like 40,000 people. Doctors started questioning it right away, and they had to pull the studies. But by then, the damage was done.
Mm-hmm.
The studies made all the mainstream media publications, and in the public's mind, HCQ was a dangerous drug.
Yeah. Well, I try not to be the most cynical person in the room. Although, that's that's like trying not to go gray. I mean, it's just part of my nature. And I'd like to think that if Hillary Clinton was president, HCQ would have been celebrated as a great idea, brilliant. All this stuff would have been different. But I just get the feeling that obviously our media, much of our culture, and the deep state does exist. The New York Times even admitted it once that the establishment of the FDA and other places are just not into giving Donald Trump any victories whatsoever. But as we noted earlier, Operation Warp Speed is the only reason, is the main reason, I should say, that we have 3 competing vaccines now for COVID-19. We'll move on to another of our rant list here from our Monday meeting, and that is you have in your notes here that you sent me, testing mania. And mask mania and contact tracing mania.
It's rampant.
It's rampant, right? And so, actually, I just saw an email came into my inbox today, unrelated, talking about drive-through testing facilities at Walmart, right?
Yeah.
And the original test had a swab that went very, very deep into your nasal cavity. It was extremely
very
uncomfortable.
Unpleasant.
Yes, and we have different tests now, and again, that's an amazing thing. The mobilization, despite everything, the mobilization of the health community in the United States to figure out what to do about this virus is actually quite remarkable, putting everything else aside.
Yeah.
But there's this idea of testing mania, and well, I follow the NFL, I follow sports, and every day there's another report that this player has tested positive for COVID, so now they're in isolation, and then 2 days later, oh no, it's fine, he didn't have it, I guess that was a mistake. Ben Roethlisberger, the quarterback for my beloved Pittsburgh Steelers, with my Pittsburgh Steelers mug, he had tested positive for COVID last week, and there was thoughts, well, he's not going to be able to play. Then suddenly, no, he's not positive for COVID anymore. He'll be able to play. It's fine. So this there is a mania for testing, and especially for professional athletes, because if you're positive for COVID, or college football, for instance,
they get tested all the time.
Yeah, they get tested all the time, and so we talk a little bit about this testing mania, and are we getting? What's the use of a test if it's positive one day and negative the next, and then positive the day after that? I mean, how reliable are the testing regimes in the United States?
Right. And Elon Musk is another one who had a COVID test, I think 3 or 4 times in one day, and the results differed every single time. It's broad-based testing, and PCR testing is very sensitive. And what I think is happening in the
what's
media.
PCR? You can explain.
PCR, I'm not going to say it correctly. Poly. It's the swab test. Okay.
Okay. And what is the testing for? Is the testing for the presence of the virus?
The presence of the virus, and they take a swab, they go deep into your nasal cavity, and then this has to be processed. It takes about 5 days.
Mhm.
So there's a time lag. And, the early stages of COVID, it's very important to acknowledge that early. But, when you're waiting 5 days for the results, in any case, it has a high false positive rate. So we say about 3 to 4% for an excellent test. Okay. Now, if you're giving tens of thousands of tests a day, that is a lot of false positives. It could be like 30,000 people who are walking around thinking they have COVID. And then what happens is they don't follow up with another test typically. They will tell their friends, they will tell their family they're all positive, and they go in and do more testing. And they might be symptomless. And you perpetuate the cycle. So what we're doing, what's happening is we're juicing the numbers. What we should be doing is using these rapid tests, which are not quite so sensitive, but they're hard to find. I wanted to get a rapid test. I can't find one within 1 hour's drive of my home. And then, the FDA approved an at-home rapid test, but again, put more regulations on it that probably are going to deter people from using it. Ideally, Jim, we should have a test that's like an at-home pregnancy test, where you can buy it in the store, do your testing, and then just make decisions based on the results. If you get a positive test, what would you do if you got a positive pregnancy test? You call a doctor and you follow up and you act appropriately. Same thing with the virus. If you're truly positive, you call your doctor and then you stay home. But under the new regulations for this new test, you have to get it through a prescription. You have to call a doctor and he's got to prescribe it for you. And then your doctor has to report the results to the local health authorities, has to do a bunch of paperwork, has to follow up to make sure you did the test, did it correctly. And, some people are going to be very reluctant to want to report all these results to government. There's not a lot of trust in government, and to report these results to public agencies where they don't know what they're going to do with the data. Are they going to contact their friends? Are they going to come knocking on their door? Are they going to lock them up in their homes for weeks on end? So they don't know. So that's going to be another deterrent for people wanting to do more frequent testing, which could really make a difference in containing the virus.
Right. And so, yeah, the test, I mean, people, I always think this when we're on our conference calls together, when I listen to your podcast and I read, when I read healthcare news at heartlanddailynews.com, I think that people forget that this is also new. It was called the novel coronavirus for a reason. This is the idea that we can get everything figured out is quite unreasonable. Normally these things would take years. It would take years just to get a test that you could rely on. And we've developed several different tests since then. So you can give people, you can grade that on a curve that they're not getting, that you're going to get false positives, that these tests are not flawless, and you work your way through it. The problem here, though, is that we are basing public policy based on the idea that these COVID tests are accurate. The media basically tells us that when somebody tests positive for COVID, it's true, it's real. And so we have these, CNN still has a ticker of the cases of COVID-19 all across the country. I suspect that will go away sometime in mid-January. Again, being cynical, when we have a new president.
These policies have shut down industries. They've closed businesses. It's really sad. Here in my home state in Michigan, many restaurants have gone out of business. Here we have another rule that restaurants have to report everybody who walks in their door to the local health department.
Right.
They don't have the capacity to do that. So they just shut down. Now they're doing, pickup, service, delivery service of food.
Well, let's move on then to masks. I mean, there's a lot of, if you were to read the mainstream media, there is no conflicting information on masks. Masks work.
Right.
And just forget about what Dr. Fauci said back in April or May, when he said, masks aren't really going to help you very much. And forget about the studies like this new Danish study that came out a week, 10 days ago on masks, and showed that statistically there is no difference in the study, very, very broad study. there's statistically no difference in you contracting COVID-19 if you wear a mask or if you don't. And if you read that study, you can see the methodology they used, and you don't have to be a scientist to figure it out. It makes a lot of sense.
Mm-hmm.
So what is the truth about masks? Why I mean, people are wearing masks now? Again, I go back to the NFL. I've always thought it really funny that you're watching an NFL football game,
Right.
and the coach on the sideline has to have his face mask on at all times. They fined $100,000, $150,000 for coaches who let it drop on their chin and all that sort of stuff. And yet you're watching the game, and the players are literally in each other's faces all day, 60 minutes. They're sweating,
Right.
They're breathing heavy right in each other's faces. And then the players on the sideline are also breathing heavy after they come off, and they're standing around. They don't have masks, but the coaches have to have masks because that's going to do something. It always seems silly to me. Well, the NFL just came out with the new rule that if you're on the sideline and not in the game, you have to have your mask on, even under your helmet. It's there's this, to me, that seems very absurd. And that this idea that masks are some kind of golden shield against illness in this thing, it doesn't make any logical sense.
Yeah, no, it really doesn't. I have to share a funny story. A friend of mine was driving on a pretty busy highway around dusk, and it's a 5-lane highway. Cars are doing maybe 60, 65. And he sees a pedestrian in the middle of the road trying to cross the highway, and he's got a mask on.
That is
he has
funny.
A mask on outside alone. They provide a false sense of security. And what's interesting about this study, it was over 3,000 people for a period of 2 months. And they had to promise that they would be out in public for at least 3 hours. And there was very little difference between those who didn't wear masks and those who did when in getting COVID. It provided very little protection. And the people were instructed how to properly use the mask. So that was another thing. But, the masks you look around, people wear them all different ways. The cloth masks really don't provide any protection. So, that study, by the way, barely saw the light of day in any major news publication. I couldn't find really any mention of it. Mm-hmm. And for a long time, the researchers had trouble getting it published in medical journals. Finally, one picked it up. They didn't want to say anything until it was published, and that happened last week. But, they found that it provides very little protection to the person wearing it. So the people who have heard about this study, who are mask defenders, say, well, you're not wearing the mask to protect you. You're wearing it to protect somebody else. But do you buy this idea that if a mask can't protect you from things coming into your mouth, do you think it's really protecting stuff going out of your mouth? Of course not.
Well, let me play devil's advocate here. I mean, the argument against what you just said, AnneMarie Schieber, is that it's better than nothing. Obviously, if you were to sneeze or do you breathing with a mask on or sneezing with a mask on, the aerosol of the droplets coming out of your mouth and nose, if you sneeze, is greatly reduced if you have a mask on than if you don't have a mask on. So what's the harm? What's the harm?
And in limited circumstances, they probably do help. If you're in a crowded elevator and people have colds and sick, and wearing masks probably do help in a big way. But it's just a matter of common sense, which everybody can figure out in their own circumstances. What is the best action at this moment? The thing about masks is they provide a false sense of protection. People are now constantly putting their hands on their face, which is not a good thing. Maybe they don't remember social distancing. That does help. Hand washing does help. But maybe when you feel like you have this mask on, you're somehow protected from doing other things that could be just as helpful. So in that sense, they are not helping. They probably might be making things worse.
Right. Well, listeners, if you're hearing some thumping sounds as we going through the podcast, that's because AnneMarie Schieber is so passionate. She keeps pounding her table.
Oh, I'm sorry.
I do the same thing. I'm trying not to do it. I'm pounding my knees instead, because this is I get hot about this subject as well. I mean, look, we all want as many people or as few people to get COVID-19 as possible. We want the people who get it to get treatment and get better. We want to protect the most vulnerable populations in the United States, that being really the elderly. If you are under the age of 70 and don't have at least 2 comorbidities, your chances of dying of this disease are extremely low, and even getting it and suffering in a major way are low. It does happen. Yes, there have been people in their 20s who have suffered and even died from this, but that is those are blown up, frankly, by the media, because statistically, AnneMarie, maybe you can talk a little bit more about this. Who is most at risk? The literature and the stories that I have read, especially in healthcare news, show that, as I just mentioned, if you are not just past retirement age, but over the age of 70 and have some other health issues that make life difficult for you already, that the chance, it's not like this is some kind of instant death disease. It's very much not like that.
Well, it's really people over 50 who have pre-existing conditions. And when you get to your 50s and your 60s, chances are you have a pre-existing condition. Many people then start to see high cholesterol, high blood pressure, maybe obesity, being overweight, diabetes, heart disease starts cropping up. So that's kind of a double whammy. As you get older, you also have these other conditions. Young people can, we've seen many cases where young people, kids are more at risk for dying from the flu than they are from COVID. But certainly when you get older, it's interesting. Florida has taken a kind of a hands-off approach to lockdowns. I have an elderly mother who lives in Florida, and she's not gotten sick. She's out every single day playing golf. And you talk to some of these doctors, and that is one of the best things you can do, is to get a lot of fresh air and stay healthy, take care of your health. What happens is there's an interesting chart in this newspaper in our December issue. I wanted to see the obesity rates. Everyone talks about how compliant Asia is about masks and lockdowns, and that's why they've been able to keep COVID under control. But the other thing they don't mention is Asia has very low obesity rates. The obesity rates in this country are like 32%. And you look at a place like Vietnam, which has hardly any COVID, and it's like 0.02%. So there is a connection. I think we want to have a magic bullet and be able to not think about other things. We look at false things that give us a sense of protection, like mask wearing, and we ignore the other big stuff. So I don't know, we live and learn. And again, the other true measure of how we're making progress on the pandemic is hospitalizations. And it is a fact that those are up, and we need to be cognizant of it. But, again, hospitals are meant to be used. Hospitals, if they are near capacity, so what? That's what they're designed to be. We have still plenty of hospital beds, and, the best course is to keep people out of the hospital. So we need to be more open-minded about some of these early at-home treatment protocols.
Okay, so we'll wrap up here with one last point on your rant email to me, on the rant notes on here. We'll skip over contact tracing mania, because you don't hear a lot of that anymore, because it's really useless unless you're very early in the pandemic. So that's been thrown away. But it has not worked, and it can't work. If there was one place that should have worked, it was New York City, and they mandated it right away. And I think I saw somewhere De Blasio or one of his apparatchiks there in New York City had admitted that it's not working. No one's cooperating. We can't contact trace, and it doesn't really matter.
And we didn't even do it for AIDS. I don't know why they think we could do it for COVID.
Oh my gosh. Can you imagine? Can you imagine contact? That would be I think that's a hate crime to do contact tracing for AIDS.
Right.
So, putting that aside, but there's the hypocrisy angle here. The Heartland Institute is known not just for our work here with you in healthcare news, but also for environmental, let's just say, climate realism, for not buying into the hype that human activity is causing an enormous climate crisis. Then we have to get out of our SUVs. We have to stop flying. We have to do all sorts of things that would dramatically disrupt our lives to save the planet. Now, my attitude has always been, you first. When I see a celebrity come on television, or there's a environmental theme movie, and they're telling everybody you need to reduce your entire lifestyle, while they jet to Davos for a international conference, while they're going to the UN climate conferences all over the world, in Kyoto, in South America, in Europe, in Asia, everywhere. I was you do it first. And when you start taking climate change seriously in your own life, then maybe I will start to listen. And so that's the way that works. And it's actually that same
thing with COVID.
That same attitude is working with COVID. Gavin Newsom, after telling everyone in California that they had to lock down, Thanksgiving is canceled, and we'll let you know about Christmas, but that's probably canceled too. So you might want to just go ahead and plan for that. He is seen the next day in one of the most exclusive, expensive restaurants called the French Laundry in Napa Valley, California, and he is not adhering to a single one of the strictures that he's putting down on everybody else in California. And so we are the ruled. He is the ruler. He will do as he wishes, and you will do what you're told. And
you know who else was at that dinner? The president of the California Medical Society.
Right. So
amazing.
Yeah.
And he wrote an apology letter, which is just laughable. And I don't want to read it because I just get too angry. But it's do as I say, don't do as I do. And the only way they can get you to do it is through coercion. Let's look to Sweden. They don't do any of this. Sweden found that coercion does not work, and people cooperate because they trust the government. They trust the guidance. They follow the rules. But here, nobody trusts anybody. We're just really making this worse.
Yeah, and that's such an important point, AnneMarie, is that this last year, the officialdom has destroyed any confidence that the people would have in it. I mean, Dr. Anthony Fauci had a great reputation, and people who had never heard of him but just heard that he was working on controlling infectious diseases in the federal government for 30 years would have thought, wow, well, that guy must really know what he's talking about. Sure, I would give him some respect. But instead, we've had all this conflicting information, and all of the strictures, as you mentioned, are not designed even necessarily it seems that way, to control COVID, but it's to control us. And it's to treat COVID as something that would instantly kill you, like it's some kind of rampaging animal that will devour you immediately, when, again, that is not the case. And we have examples of Sweden and some other, I think Denmark may have been a little bit more lax than us. God, everybody was more lax than us just about, except for Great Britain and maybe Australia. But in the United States, you had Governor Kristi Noem of South Dakota, who decided right from the get-go, he's like, I trust the people of South Dakota to take care of themselves and to be careful to make sure they're taking care of their neighbors. And South Dakota has not had, even relative to population, the kind of COVID infection rates that you see in California, which is lockdown central, and New York City especially, which is lockdown central.
It's amazing when you take that approach, the sense of responsibility that people feel, and they will do the right thing. Nobody wants to get sick. Nobody wants to make others sick. But when you lack government trust, and then you're told to do this and told to do that, and you see selective enforcement, and you see hypocrisy, and you see hair-splitting regulations, you can't sell this, but you can sell this, and you can do this, and you can't do that, you lose public trust. And our leaders in government have done that amazingly well.
Yeah, I think that's a great place to end it. Maybe the biggest victim of all this, and we will recover from COVID-19. It will, as Donald Trump said, go away, at least in a large sense. We're not going to be obsessed over it as we are now. But the damage has been done. Maybe the biggest victim of COVID-19 will be public's trust in their government and in authority. And that's over the long term. As a libertarian, I don't trust government very much at all. And I don't look to government to be my hero, my savior. I look to myself and my neighbors and my friends, and liberty is more important to me. Right. But we're going to have, but this trust, I don't think will ever come back for a large portion of the population.
The thing is,
radicalized people.
Libertarians
for government.
Libertarians are not anti-government. We understand there is a need for government, but not over government.
Right.
And you're right. We have just run roughshod over our civil liberties, and I don't know. It's very sad.
Yeah, it is very sad. Well, I like to try to end on a positive note, but sorry, listeners, we're not going to be able to do it this time, except to say thank you, AnneMarie Schieber, for being a guest on your very own podcast. This is the Heartland Daily Podcast and the healthcare news portion of that podcast. I hope we get to do this again soon.
I would love doing that, Jim. Love to vent.
All right. Thank you, listeners, and we'll talk to you again down the road. And that's